Hello, everybody. This is Dr. Bob DiMaria with another episode of Ask Dr. Bob. There are some very good questions, very detailed questions that I'm going to need to explain a little bit more detail in reference to the fact that I might need to have personal conversation with some of you because your condition warrants a lot more investigation to get to the root cause. Dr. Bob, can you help me get rid of eczema? I've been trying to find something out now for several months. You must be following me on our social media sites because you are taking some ADB5, which is for the adrenal, and black currant seed oil, which does help skin issues. I know you've been applying the castor oil pack, which is very good. When somebody has eczema, usually it's an omega-3 oil possibility of a deficiency or inflammation or a food sensitivity. So you may consider the omega test, maybe an OptiChem profile, and maybe a test called the FIT test. Those would be tests that I would recommend to you in the case that you decide to have a personal consultation with me. It could be a food sensitivity. Dr. Bob, you know that you're saying to me that I don't encourage bioidentical hormones, which is correct. We work on helping adrenal gland function. You've been using some thoughts, or you've been using a product line, or you've been using a process called Sotopel therapy. I do not know anything about that particular therapy. Your body signals include no libido, you have anxiety, memory issues, lack of focus, you're overwhelmed easily, you have brittle nails, and you have ridges on your nails, hair is thinning, and you have some heart palpitations. As you can see from those body signals, could be so many possibilities. I may encourage you actually to start with reading my book, Dr. Bob's Drugless Guide to Balancing Female Hormones, or Dr. Bob's Drugless Guide to Mental Health. Both of them can give you a direction in the area that you need to go. You may consider a personal consultation so we can check your diet. We can find out other areas that might be causing your issues, including an omega test, a FIT test, and an OptiChem profile. Hi, doctors. I have been living in Mexico. You mentioned that you really miss us. You have crazy mood swings and tons of sugar craving, and you really want to be helped with what's going on. You want some tips. So here's my number one tip for you is I would minimize or avoid fruit because fruit for some people replaces sugar. You may want to focus on non-starchy green vegetables and protein. Don't overdo the protein. I've learned from my own experience if I eat too much protein at a meal, it may in fact cause some sugar cravings. And you can have mood swings when your blood sugar does go up and down. Dr. Bob, I've had bad allergies to foods and environment with lots of sinus pressure and have been getting allergy shots. You want to know what possibly to do. I would avoid some common foods: peanut butter, dairy, wheat, and sugar. You also may consider having the FIT test, which is a food sensitivity test to evaluate 130 foods. For example, let's say you're sensitive to eggs. You may be wise to eliminate the whole poultry family, including chicken and turkey. I'm just giving you that as an example. Dr. Bob, my thyroid gland was removed years ago. You had radiation and you had some other events happen to you that caused your thyroid to be removed, and you wanted to know if you need to be on medication. Yes, you will need to be on medication, but what I would encourage you to do is have a thyroid profile to evaluate your TSH, your T3, and your T4 to find out what supplements that you could use, because thyroid hormone basically is only T4, which is the inactive thyroid, and it needs to go and be translated to T3. Very good question. Dr. Bob, I'm 62 years old and you're having issues with hearing and you have a difficult time with soft sounds. You miss a lot of the first letters of words. You did use some hearing aids. You wanted to know what else you can do. Well, the answer I had on the question above talked about foods, dairy, wheat, peanut butter, sugar. They cause inflammation in your body, which is fluid retention, which can impact your ears and your ability to hear. I also know that individuals have noise sensitivity when they don't have enough B vitamins. You may consider having what we call the FIT test to find out exactly what foods you're sensitive to. Hello, doctor. What vitamins would you recommend for psoriasis? What I have learned from my experience that the leading cause of psoriasis is a liver issue. You may consider getting Dr. Bob's Guide to Detoxification and follow my examples of what you would logically do to give your liver some support. You may consider the castor oil pack. You want to have your liver enzymes tested. If you're on any medications, they may have liver bad effects. Last question, Dr. Bob, you read my book, you watched me on various TV shows, you've done the ABCs, you've watched the hormones, you don't eat sugar, and the bottom line for you is you're dealing with leg cramps at night. What I have found, once again from my experience, the leading causes of leg cramps is not enough calcium in your body being absorbed. You may not have enough digestive enzymes. We determine that by looking at an OptiChem profile. Then you also mentioned you had joint pain. You must have talked to a healthcare provider via a video or telemedicine, and you had this joint pain of your finger, and they told you it was gout. And what I've learned from my experience, gout usually impacts the big toe. I mean, everybody is different. You may consider some blood chemistries to determine exactly your uric acid level and, in fact, if you have gout. Now, on our website, which is druglessdoctor.com, you could get a complimentary first chapter of my latest book, Dr. Bob's Drugless Guide to Mental Health. I'm Dr. Bob DeMaria.